So when it comes to population health, how do you approach it beyond just legal compliance?
Yeah, great question. I think the whole notion of population health back in the sort of the early and late 90s, and I'm looking at Tim and some other colleagues here in the room, there was a lot of emphasis on population health, right? How do we look at a segment of the population and treat them like a segment? You know, I'm taking all white males and I'm going to treat them this way, or I'm taking everyone that lives in this zip code and I'm going to treat them that way. I think we are swinging the pendulum ever so slightly and slowly to go to more customization, i.e. personalization. And I think that's opportunity to kind of safeguard against that standardization that I think has occurred a lot in healthcare, particularly as it relates to cancer, because every cancer is different. Every cancer type is different. Through clinical trials, we're learning a ton of things each and every day, but even more importantly, cancer impacts the body differently. There are certain drugs that don't always impact the one person the same way as another person. So there's tremendous opportunity to really take personalization, i.e. customization in medicine, and have that top of mind.
So if you're not in healthcare and you realize that the shifting demographics are going to require them to provide more personalized benefit plans, how do you get an employer started? What kind of strategic partnerships are involved with something like this?
So I always like to say there's sort of 4 P's to healthcare. It's the patients. Obviously, we should start with the patients. We don't always do that though in healthcare, unfortunately. 2 is sort of the policymakers. 3 are the providers, and 4 are the partnerships. So we are deeply rooted in partnerships, not just internal to healthcare, but even more external. We really wanted to make sure that there's opportunity for us to kind of look at healthcare differently.
Good.
Because everything that you put in your body, that's what's going to come out, right? I think we're all in healthcare in some way, shape, or form, in some capacity, and it gives us an opportunity to kind of look at healthcare as a sort of a framework and not just an industry.
Yeah.
So I read a study. I think this was in Harvard, the Harvard Business Review. And one of the things that they said is that the healthcare part, the healthcare medicine, is only roughly about 10% of health. Everything else is related to environmental factors, to the food that we eat, to everything that we touch, to where we live. Those are the kinds of things that we should be kind of putting into our psyche as we move forward, because those are the kinds of things that are going to determine if we get cancer or not. That's going to determine if we have a chronic disease. So those are the kinds of things that we're thinking about and how we're partnering at CTCA.